I felt when I was listening, it was not just a technical journey of evidence and impact and innovation. It was emotional for me. It was a journey from despair to hope and action. Maureen, when you were sharing your story this morning of Jen and baby Maureen, a child death, a tragedy. A preventable death is an injustice. And what we are here for, you reminded us why we're here. We're here to turn injustice into action and eventually to justice. When you or your colleagues have to make hard decisions about funding architecture or where to allocate resources, how do we make Dr. Kabanda's life easier and make the choices that you're trying to advocate for, your Minister of Finance, to make it a little easier to allocate that budget line. Align and integrate behind the country-led agendas. And at Africa Frontline First, we're working with Shun's team a lot on how do we take that commitment to alignment and turn it into practical tools for doing so, working with other donor partners and implementing partners. Align and integrate behind the country agenda in a systems approach, which may not be cool always, but it is the right path forward, and we have to make that easy. The one plan, one budget, one M&E approach that Dr. Kabanda was referencing earlier is a great place to start. Align and integrate. Second, innovate. And invest in innovations in immunizations. We heard a number of them today around how you might target zero-dose patients in a more detailed, localized, granular way. I think the work that you, Ricardo, and Dietrich are doing, particularly on digitization and data, can really accelerate that kind of targeted approach. The research that Emily noted on CHWs as vaccinators is pushing the boundaries of what we think is possible through this workforce. Innovate, invest in innovation. And lastly, enabling policies and politics. The innovations push what we think is possible. The policies and politics bound and guide what is permissible. And we need to close that gap a bit.